Our next segment, we have Grace Marie Turner, who is an expert in all things healthcare. She's been, sorry, Grace Marie, trying to bring up your bio here, very extensive bio. She's the president of the Galen Institute, which is a public policy research organization that she founded in 1995 to promote an informed debate over free market ideas for healthcare reform. She served for a 3-year term on the National Advisory Board for the Agency for Healthcare Research and Quality as a member of the Medicaid Commission, making recommendations to modernize and improve Medicaid. She's been published in hundreds of major newspapers, Wall Street Journal, New York Times, USA Today, has appeared extensively on radio and television programs. She's the founder and facilitator of the Health Policy Consensus Group, which serves as a forum for analysts from market-oriented think tanks around the country. So Grace Marie, thank you so much for joining us, and we're looking forward to hearing what you have to say here.
Wonderful. Thank you so much, James, and thank you and Lewis and all of the team at Christ Medicus for putting together this really wonderful conference. They've asked me to talk about the American healthcare system and what we have learned during the COVID-19 crisis. And I think in a word, we can say that we have learned a lot about the goodness and generosity and strength of the American people. While certainly it's a very fearful time, we have seen so many examples of people really loving their families, their communities, and their country in all that they have done. And one of the things that I think is really a real top-line lesson from all this is learning that we're really trying to find a better balance between the role of government and the role of the private sector in our lives. And frankly, a lot of the places where we have seen successes and agility, it's been in the private sector, with manufacturers being able to repurpose their assembly lines to make personal protective equipment. With the pharmaceutical industry, there now are 50 vaccine trials going on. And this is a wartime mobilization to try to find both cures and both vaccines and treatments for this virus. So, and when we've seen clumsiness, it's often been with government agencies like the CDC and its delays in being able to get tests approved. So I think that we've seen hopefully some lessons that we can learn about going forward. One of the things that I think has really been particularly important, almost 500 rules and regulations have either been ended or waived at the federal and the state level, including rules that allow much more telemedicine, that allow doctors to practice across state lines, that allow doctors from Colorado to go to New York to help with the surge of the need to treat coronavirus patients there. So those are all things that we are hoping to build into the system going forward. When the government gets out of the way, the private sector is able to respond much better. So also just the huge billions of dollars in money that's been donated both by people and by companies, supplies, moving supplies around. It's really quite impressive to see our country's response. But I want to talk, and I think it's important to recognize some of the dangers ahead. And as we've heard this morning, it's hospitals and doctors' offices and clinics really are struggling. Hospitals in particular have not been able to do their normal care for patients because they have been basically shut down to do anything except COVID treatments, and that the revenue losses are significant. Clinical labs, where we need as many tests as possible, they're having to lay off workers because they're not getting their normal flow of clinical lab requests. And you see it with people not going in to get cancer screenings, for example. It's a serious problem, and particularly, and I think the last panel was just so moving to hear from the people who are really on the front line in taking care of patients and seeing the incredible struggle of private practices and small clinics in trying to survive, where they don't have the the revenues and the resource bases that some of the larger facilities might have to be able to tide them over. So it's just, we have to work together, and there needs to be a public policy response, which is sort of the space I work in, to make sure that we do not lose this valuable resource of the more fragile part of our healthcare system, but the part that does respect the dignity of the patient, that respects life, that makes sure that people are treated as in the image of God that we all see in these patients. So having a mobilization of an effort to make sure that these practices survive is crucially important. And of course, it's not just doctors. Millions of small business owners have invested their life savings in creating new businesses. Some of them have just opened this spring, and they are wondering how they are going to survive. Many of them continue to pay their employees, maybe not fully, but partially, keep their employees on their healthcare programs. Really important work. And I also, we need to think about all of the people who are not getting the care they need. There was a piece in the Washington Examiner recently, an orthopedic surgeon who talked about a patient of his who had a ruptured disc and a pinched nerve. And she's not an emergency case, so she was not able to get the care she needs. 3 small children trying to manage this with tremendous pain. As I said earlier, cancer screenings and treatments delayed. I'm worried that we are going to have an explosion of delayed care, needs for delayed care, as we move back into hopefully some unlocking. But one of the things that's happening is we're likely to have millions more people who are uninsured because they've lost their jobs in some of these companies that are not coming back. And there will be efforts to try to make sure they're whole. We are working on public policy initiatives that will allow them to have coverage without putting millions more people on government-run programs. And the bills that have been coming through Congress, the one that was passed by the House last night, likely not to go anywhere in the Senate, but it did not have high protections for the significant federal and state healthcare programs that they would either create or expand. For example, it would allow, if were it to pass, it would allow the Planned Parenthood to apply for the patient protection loans that was excised from the CARES Act. It would make sure that it would not have high protections for any of the other government spending. So we have to be vigilant in making sure that in caring for people who have lost jobs, who've lost their health insurance, who need government support, that we maintain the high protections. I know that the Susan B. Anthony list is working very hard on that, and many other related organizations. Lewis, I know that you also have a huge voice in that. So just quickly, and I know we only have a few more minutes, what should we be doing? We must continue to pray and keep our faith alive. Be not afraid. That's so right what Dee Dee said at the end, or was that, maybe it wasn't Dee Dee, but whoever it is, it's obviously the guiding idea to make sure that we keep our strength and keep our faith, and make sure your voice is heard with government leaders. A lot of them are trapped in their districts, so if you can go make an appointment, talk with them about the importance of protecting these fragile practices and making sure that we protect that we keep high protections in any legislation that goes forward. And you certainly should be supporting Christ Medicus for its continuing effort to keep these conversations alive and to create this kind of community of people who share common beliefs, who understand the importance of keeping our faith at the center of policy decisions. Certainly support the private charities, private clinics, doctors that are working so hard to try to keep practices alive, to take care of patients and do it in a faith-centered way. And so what should our country be doing? We have to be focused on caring for the most vulnerable. There have been a number of stories recently, and I've written about this as well. The greatest proportion of deaths from COVID have been elderly people with comorbidities in nursing homes. It's at least half of all patients. Some very bad public policy decisions have been made. Governor Andrew Cuomo in New York, for example, issued an order at the end of March that said that no nursing home could refuse a patient who was being released from a hospital that had COVID. They were not allowed to test new patients to see if they were infected. Nursing homes in New York, as a result, have become hotbeds of infection. Fortunately, the governor this week reversed that order. There are other states that have done the same thing, but the most vulnerable really must be our focus always, but particularly here, to make sure that they are protected, that workers have the equipment that they need, and that they now are able to isolate people that have had this virus in facilities where they're not going to infect people who are well. And ultimately have to open our economy again. And we can do that by focusing on those places and those people, those parts of the country where we have a problem, and then being able to open the rest of the country. In half of the countries in the half of the counties in the United States, there has not been a single COVID-19 death. This is a paper that's going to be coming out probably this week, the Heritage Foundation, by my colleague, Doug Badger. Half of the counties in the United States have not had a single COVID death, and yet they are all being shut down the same way that the rest of the country is, the way that the epicenter in New York is. So we can't let those epicenters lead the rest of the economy, and all of the collateral damage of people who are suffering mental illness, depression, even suicides, because they just don't see a path forward. There is hope there, but we have to change gears. Very hard thing for the government to do, change gears on its policies. Slowing the spread is no longer the agenda. We've got to be able to it was 30 days to slow the spread. We did not have overwhelmed hospital capacity. We built hospitals, we brought in ships. We have the capacity to take care of people who get sick. We need to have progress toward vaccines, a greater understanding of treatments that are available, and being able to protect the people who are most at risk and who are really helping to drive up the numbers that are frightening the country from getting back to normal. So I'll leave it there, and thank you very much for giving me a chance to talk about the public policy side of where this pandemic is taking us.
Thank you so much, Grace Marie, for joining us and for your comments here. I would highly recommend everybody really to look at the Galen Institute. Their website is Galen, Galen,